Hi everyone, my name is Brooke Cole, and my research proposal is titled Familial Mental Health, the Effects Parental Mental Health Has on Adolescents' Mental Well-Being. Mental health is defined as one's cognitive, emotional, and behavioral well-being, so it explains how people think, feel, and act, so it's an essential part of everyone's daily lives. It has just begun to be acknowledged as a vital role in people's lives in the past century. It wasn't until 1909 that the United States created a National Committee for Mental Hygiene, so it's a newer topic of research and need for policy. The purpose of this study is to learn more about adolescents' mental health and parental mental health and how it has an effect on one another. The evident problem conducted is mental illness within the family structure. Discovering why this happens and creating interventions to stop the matter from affecting future generations is the goal. It has been found that 68% of women and 57% of men with mental health issues are parents. It was also found that 8 in 10 children among the ages of 3 to 17 receive treatment for depression, while 6 in 10 children receive treatment for anxiety. So this demonstrates the significance of this study and the need for future research in this area and for interventions. For my literature review, I examined 6 articles, one being a 3-generational study of mental health relationships between grandparents, parents, and children, then experiences of stigma by association among family members of people with mental illness, and then the relation between parental mental illness and adolescent mental health, the role of family factors, and the development and validation of the guilt, shame questionnaire for adolescent parents with mental illness, and the prevalence of mental illness among parents of children receiving treatment within child and adolescent mental health services, a scoping review, and lastly, the effectiveness and usability of a web-based mindfulness intervention for families living with mental illness. Each looked at how mental illness among family members is a common problem in today's society and recognize the need for future studies. They looked at how one's family might suffer from anxiety, depression, substance abuse, and other mental health disorders, and how it increases one's risk to struggle with it as well if one of your family members does. It was also found in several studies that children with parents with mental illness are shown to have a higher risk than other children to develop a mental disorder. Overall, the articles discussed adequately presented the problem of mental illness among the family structure, and they were consistent with their findings. The research question for my study is we'll look at how the causes for familial mental health and how parental mental health and family dynamics play a role in mental health issues among adolescents. I have 2 hypotheses for this experiment. One is looking at the lack of healthy coping strategies and a high volume of emotional-driven decisions on how they might cause specific mental health issues among the family. So if the family dynamics such as coping skills and decision making are unhealthy, then it can be detrimental to the mental well-being in adolescents. The other hypothesis looks at the negative stigma towards mental health, which might cause family members to not seek adequate treatment for their mental disorder. If parents or role models for children don't seek treatment for their mental health issue due to shame, then children might not either out of fear. So suffering from a mental illness is looked down upon, therefore many people don't seek treatment like counseling or medication. Looking into the dependent and independent variables, the dependent variable in this study is the mental health status of adolescents, while the independent variable is the parents' mental health and family dynamics. The researchers in this study will use the nominal level of measurement to examine the independent variables and nominal, interval, and ratio levels of measurement to observe the dependent variable. in regards to variables and concepts, there will be numerous variables. The type of mental health issues in regards to the study can be concepts that need to be defined and specified. Not every mental health issue will be allowed to be in this study. We will only look at anxiety, depression, and OCD. Mental disorders like schizophrenia, ADHD, ADD, and bipolar disorders will be controlled for and screened out for this experiment. Indicators will be low mood, fatigue, irritability, poor concentration, impaired sleep, loss or loss of appetite, low self-esteem, feeling of worthlessness, or suicidal ideations. The dimensions of this study will be depression, anxiety, and OCD, which will look at life satisfaction. In concern to the research design, it'll be a cross-sectional research design in order for the researchers to measure the outcome and the exposure of the participants in the study. The design will be able to determine if the parents' mental health and familial factors are associated to an increase in adolescent mental illness. This study will also be a mixed method design using both qualitative and quantitative methods. The population in this study will be families of adolescents who have parents who struggle with mental illness. The study will look at the effects of parental mental well-being on adolescents in the family and certain family dynamics that might play a role. Represented in the study will be families who have adolescents from ages 13 to 19 years old. The study will consist of 100 families partaking in the study, with 50 families not having a parent suffering from a mental disorder, and the other 50 having a parent who does struggle with either anxiety, depression, or OCD. In regards to the data collection and analysis, there will be several questionnaires, self-reports, an interview, a psychoeducation session, and a 3-month follow-up interview. Both the parent and the child will partake in the background questionnaire concerning their socio-demographic features. The parent-child interaction parental monitoring questionnaire will be given to the parents to measure the parental levels of observing the child. The family environment questionnaire will be given to both the parents and the adolescents to observe the familiar support, expression of emotions and opinions, and the conflicts present in the family. The wellness assessment will be given to both the parent and the adolescent to gain more information about the family structure and skill level. And lastly, the strengths and difficulties questionnaire will be given to the adolescents to measure the peer relationships, conduct issues, emotional problems, and social behaviors. The social workers who will be partaking in the study will be trained on how to give the interviews and the psychoeducation sessions. The interviews conducted will be to gain more insight about the parent-child relationship, their interactions, the environment, and mental health status. The adolescent and parents will conduct the first interview separately and then together for the 3-month follow-up. The psychoeducation sessions will have both the parent and adolescent present to improve problem solving, communication, and coping skills. Once the data is collected and analyzed, the researchers will go through to examine the differences the families who had a parent with mental illness and then families who did not. Then we'll go on to the development of the questionnaire. I created the wellness assessment questionnaire, which will look at the family's knowledge and skill level. To ensure that this questionnaire is accurate and precise, the researchers will run a pre-test on a small selection of people who are not involved in this study to confirm that the test is valid and identify any problems that might be presented. It'll have a large generating pool of questions in order to cover all constructs and more word choices. Also, both open and closed-ended questions will be utilized to gain a variety of responses. Questions that will be asked will measure the parental levels of observing their child, socio-demographic features of each participant, familiar support, expression of emotions and opinions, conflicts, and the family structure. There will also be variance, validity, and reliability in the wellness assessment questionnaire to ensure that it is accurate and precise. There will also be internal consistency, reliability, and interracial reliability. There are a few limitations in this study. One is the number of participants. Having a larger sample size would ensure a broader range of data. Also, allowing the parents with anxiety, depression, and obsessive disorder to only partake and not each mental health disorder is a limitation, since there are others out there that can affect the family. Also, having the family do the self-report questionnaires might have biases and skew the results, since they might not be able to accurately analyze themselves and their emotions. But having the interview section with the social workers will help prevent that. Overall, this study will strive to gain precise results of how parents play a role in adolescent mental health. It will allow for more scientific understanding in this field, preventing social workers, therapists, school officials, and other professionals to have a better concept of how mental health plays a role in adolescents' mental well-being. Overall, I learned the definition of several items discussed in the presentation and how to implement them into a research paper. And I also learned how to create a questionnaire and an informed consent form. And thank you so much for listening, and I hope you have a great day.